Ladies and gentlemen, welcome to World Health News. This is your host, Dr. Yavuz Selim Sılay, physician, entrepreneur, and venture architect. Today, I have a very special episode about World Health News, World Health Organization Essential Health Service Survey. This episode will cover this very important survey. In World Health Organization Global Pulse Survey, 90% of countries report disruptions to their essential health services since COVID-19 pandemic, ladies and gentlemen. World Health Organization is rolling out learning and monitoring tools to improve service provision during pandemic. The World Health Organization published the first indicative survey on the impact of COVID-19 on health systems based on 105 countries' reports. Data collected from 5 regions over the period from March to June 2020 illustrate that almost every country, 90%, experienced disruption to its health services, with low and middle income countries reporting the greatest difficulties. Most countries reported that many routine and elective services have been suspended, while critical care such as cancer screening and treatment and HIV therapy has seen high-risk interruptions in low-income countries. The survey shines a light on the cracks in our health systems, but it is also very important informing for us the new strategies to improve healthcare provision during the pandemic and beyond, said Dr. Tedros Adhanom Ghebreyesus, the World Health Organization Director General. COVID-19 should be a lesson to all countries that health is not an either-or equation. We must better prepare for emergencies, but also keep investing in health systems that fully respond to people's needs throughout the life course. Services hit across the board. Based on reports from the key informants, countries on average experience disruptions in 50% of a set of 25 tracer services. The most frequently disrupted areas reported included routine immunization, outreach services, and facility-based services, non-communicable disease diagnosis and treatment, family planning and contraception, treatment for mental health disorders, and cancer diagnosis and treatment. All of them have been disrupted more than 50%. And countries also reported disruptions in malaria diagnosis and treatment with 46%. Tuberculosis cases detection and treatment with 42%, and antiretroviral treatment with 32%. While some areas of healthcare, such as dental care and rehabilitation, may have been deliberately suspended in line with government protocols, the disruption of many of the other services is expected to have harmful effects on population health in the short, medium, and long term. Potentially, life-saving emergency services have disrupted in almost a quarter of responding countries. Disruptions to 24-hour emergency room services, for example, were affected in 22 countries. Urgent blood transfusions were disrupted in 23 countries, 23% of the countries. And emergency surgery was affected in 19% of the countries.
Since WHO's Director General declared a public health emergency of international concern over the outbreak of novel coronavirus. Now, as in past weeks, the situation in the European region remains serious. In broad terms, while plateauing in Western Europe, the gradient of the AP curve steepens as we look east. Across the region, cumulative cases have increased by 15% in the past 7 days and now stand at 1,408,266 cases. Deaths have risen by 18% over the same period. Tragically, 129,344 people in Europe have now lost their lives. My thoughts and deepest sympathy are with the families and loved ones of those we have lost. Today, the European region accounts for 46% of cases and 63% of deaths globally. The region remains very much in the grip of this pandemic. Spain, followed by Italy, the United Kingdom, Germany and France, still have the highest number of cases. But following social and physical distancing measures introduced some weeks ago, we are now seeing evidence of a plateau or reduction in the number of new cases. We must monitor this positive development very closely. In the eastern part of the region, Belarus, the Russian Federation, Kazakhstan and Ukraine, cases have increased in the past week, while in Turkey the situation is stabilizing. Here we must maintain the full arsenal of measures we have to suppress transmission. As these figures demonstrate, the situation across our region is not uniform. Every country is mapping out its route to a new normal, and every country is at a different place. Of the 44 countries in the European region that have implemented partial or full domestic movement restrictions, 21 countries have started easing some of these measures to different degrees, and a further 11 are planning to do so in the coming days. As I have said before, this virus is unforgiving. We must remain vigilant, persevere and be patient, ready to ramp up measures as and when needed. Last week, we issued essential guidance for countries considering and planning COVID-19 transition. In that guidance, we emphasized that health systems must have the capacity to operate along a dual track, continuing to deliver regular health services, whilst responding aggressively to COVID-19. It is clear that both health service and society-wide measures put in place to address COVID-19 have had an effect both on the delivery of other health services and on people accessing such services. Other vital health services have been crowded out. I have two key messages for you today. One, to the governments and health authorities. I urge you to find ways to reintroduce other health services safely and quickly, once community transmission is under control. Two, to the people and communities, ensure your child is vaccinated. If you have concerns about accessing these services, there are ways to do so safely. So let's look more closely at immunization. Last week, we marked European Immunization Week. Immunization is one of the most effective health tools we have, protecting children from many diseases that would otherwise be debilitating or deadly. Now, as scientists work together across the globe to develop a safe, effective vaccine against COVID-19, we are once again reminded of how precious vaccines are. I am very happy to be joined by our chair of the European Technical Advisory Group of Experts, Professor Ade Finn, today on this panel. Since 2017, the European region has been experiencing a resurgence of measles. In 2018, over 500,000 children missed their first dose of measles vaccination. In 2019, over 100,000 people across all age groups were infected as a result of this and long-standing immunization gaps. Today, measles continues to spread in some parts of the region, affecting over 6,000 people in the first 2 months of this year. We cannot allow this situation to worsen. We should do everything within our powers to prevent children becoming victims of this pandemic due to their vulnerability of vaccine-preventable diseases such as measles, diphtheria, mumps, and rubella. COVID-19 cannot be permitted to claim this collateral damage. We are concerned that countries may have seen interruptions in routine immunization services, including among vulnerable groups, and the interruption of measles outbreak response activities. To governments and health authorities, I say this: immunization services are essential. If they have been interrupted, catch-up measures must be taken as quickly as possible. We cannot allow the impact of COVID-19 to be amplified by neglecting other vital health protection measures. I do appreciate that during COVID-19, countries have found new and innovative ways of reaching children, using temporary vaccination points. Health professionals delivering immunization programs across the region are working hard to ensure that as many children as possible have access to vaccine services while preventing COVID-19 infection. Some health services have introduced parallel tracks with regular checkups and vaccinations for babies, staggered to ensure limited indoor waiting times, and kept fully separate from curative care for others. These efforts are very welcome, and I also commend the determination of parents and caregivers to keep their children safe. I urge countries to continue prioritizing immunization, innovating services, communicating to parents, and meticulously tracking every single missed vaccination. Catch up as quickly as possible where needed. To parents, make no mistake, the safest choice also during this pandemic is to vaccinate your children. Use this opportunity to protect them and others from diseases that we can prevent. This leads me to my final message for all of us. COVID-19 is not going away anytime soon. Dual-track health systems can offer the flexibility and resilience needed to manage repeated waves of coronavirus infections and the increasing demand for other services. The new COVID-19 Health System Response Monitor, launched by the WHO Regional Office, the European Observatory on Health Systems and Policies, together with the European Commission, is collating evidence of how health systems are responding to the pandemic. Please use that valuable resource. We must be alert and open to new ways of delivering and receiving health care. We cannot risk seeing the tragedy of COVID-19 mirrored in a second catastrophe of ill health from other causes. In short, to authorities, maintain a dual-track health service. To the public, keep using immunization services where available. By doing so, we leave no one behind.
Disruption due to a mix of supply and demand side factors. 76% of countries, so 3 out of 4 countries, reported reductions in outpatient care attendance due to lower demand and other factors such as lockdowns and financial difficulties. The most commonly reported factor on the supply side was cancellation of elective services, 66%. Other factors reported by countries included staff redeployment to provide COVID-19 relief, unavailability of services due to closings, and interruptions in the supply of medical equipment and health products. Adapting service delivery strategies. Many countries have started to implement some of the World Health Organization recommended strategies to mitigate service disruptions, such as triaging to identify priorities, shifting to online patient consultations, changes to prescribing practices, and supply chain and public health information strategies. However, only 14% of countries reported removal of user fees, which World Health Organization recommends to offset potential financial difficulties for patients. The Pulse survey also provides an indication of countries' experiences in adapting strategies to mitigate the impact on service provision. Despite the limitations of such a survey, it highlights the need to improve real-time monitoring of changes in service delivery and utilization as the outbreak is likely to wax and wane over the next months, and to adapt solutions accordingly. To that end, ladies and gentlemen, World Health Organization will continue to work with countries and provide supportive tools to address the fallout from COVID-19. Given countries' urgent demand for assistance during the pandemic response, World Health Organization is developing the COVID-19 Health Services Learning Hub, a web-based platform that will allow sharing of experiences and learning from innovative country practices that can inform the collective global response. World Health Organization is also devising additional surveys at the subnational level in health facilities to gauge the longer-term impact of disruptions and help countries weigh the benefits and the risks of pursuing different mitigation strategies. So the survey, Rapid Assessment of Continuity of Essential Health Services during the COVID-19 pandemic, was conducted in 159 countries, all World Health Organization regions except the Americas. 105 responses were received, which is a 66% response rate, from senior Ministry of Health officials covering the period from March to June 2020. The purpose of the survey was to gain insights and perspectives on both the impact of COVID-19 pandemic on the top 25 essential health services in each country and how countries are adapting strategies to maintain essential services. While pulse surveys have some limitations, the strength of this effort is that it is comprehensive, looking at 25 core health services as opposed to a single topic survey, and representing disruptions to these services in a comparable way across over more than 100 countries. It reveals that even robust health systems can be rapidly overwhelmed and compromised by a COVID-19 outbreak, reinforcing the need for sustained data collection and strategic adaptations to ensure maintenance of essential care provision.
We are living through an exceptional time when every one of us has been called upon to prevent the spread of COVID-19. The COVID-19 situation in the European region remains very concerning, but we are hopeful. I take the opportunity of European Immunization Week to reiterate that we must not, especially now, let down our guard on immunizations. Access to vaccines for all has transformed our societies, but it is a public good that must be maintained to be effective even in difficult times. Our overstretched health systems cannot bear any outbreaks of vaccine-preventable diseases. The health and/or economic consequences of this pandemic are affecting everyone. The most vulnerable, who are often left behind by immunization services, should not suffer the added burden of vaccine-preventable diseases. Measles affected over 100,000 young and old in this region last year. This virus is not gone. It will resurge again if we do not do everything in our power to stop it. As one of my 4 flagship areas, prioritizing immunization is central to WHO's vision for health in the new European Programme of Work. Immunization is crucial to achieving universal health coverage and Sustainable Development Goals, as well as vital component of our society that assures health security across the region. I therefore take this opportunity to commend all the ministries of health in this region for heeding our call and doing everything possible to prioritize routine immunization as part of essential health services during this pandemic. And I warmly thank our tireless healthcare professionals dedicated to leaving no one behind in providing healthcare and delivering vaccination services. Vaccination is a right and a responsibility, and it is up to all of us to ensure that we are protected together. Vaccines save lives.
A devastating epidemic can start in any country at any time and kill millions of people because we're not prepared. because we're still vulnerable.
Epidemiologic investigations are underway, but yes, it's certainly possible that there's limited human-to-human transmission.
I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus. We have a window of opportunity. While the number of cases, more than 99%, are in China, in the rest of the world, we only have 176 cases. Let's use this window of opportunity to really invest in prevention, to invest in control, and prevent this virus from spreading. It's time to act. The detection of this small number of cases could be the spark that becomes a bigger fire. And if the world doesn't want to wake up and consider this enemy virus as public enemy number one, I don't think we will learn from our lessons.
We have over 400 scientists. There's been huge global interest in this topic and a real desire to collaborate and contribute.
Fit this virus.
Ladies and gentlemen, during these tough times, it is very important to work with data and follow these type of initiatives and understand where we are lagging so we can correct that and build the right strategies and invest truly in health innovation. This is your host, Dr. Selim Sulay, physician, entrepreneur, venture architect. I'm really thrilled and excited I was able to share this very important World Health Essential Health Service Survey episode. Take care, all the best, and stay tuned to NTR with Dr. Selim Sulay. Bye.